Gastroenterology is a great specialty where I get to take care of a variety of patients and do a different thing every day. Some days scoping, some days working in the hospital with sick patients, and some days working in the office. So it just presents a great variety. Most days I spend some time seeing patients in the office and also spend some time at the hospital seeing sicker patients. And then on other days I spend the majority of the day performing procedures. The main procedures that I specialize in are endoscopy, which is examining the upper intestinal tract with a scope, colonoscopy, which looks at the lower intestinal tract. I also perform ERCP, which is a procedure where we're able to actually get instruments into the bile ducts, underneath the liver, and also into the ducts of the pancreas. If I had to choose one thing that we do that helps patients the most, it's preventing cancer. When patients have a screening colonoscopy, we can remove polyps before they turn into cancer, and that saves lives. Another disease that I see often is Crohn's disease. I remember one case was a gentleman in his 20s. He'd been having problems with abdominal pain and diarrhea for greater than 5 years. He had seen another gastroenterologist and was told he had a nervous stomach. After reviewing his records and doing a few tests, I determined he had Crohn's disease. I treated him, and he's been asymptomatic now for several years. From the moment you arrive at the office, you'll be greeted by a smiling face. Our staff will make you feel comfortable. If you're here for a procedure, our nurses will put your mind at ease. They're going to make sure you have a safe, pleasant experience. My approach when I meet a patient is to treat them as if they were my family member, like my brother or my mother or my grandmother, depending on their age. Treat them with respect and worry about their well-being and safety. To me, that's really the Riverside care difference. When I'm not at work, I like to cook, I like to golf. And one thing that makes me even as happy as saving lives is when Duke beats North Carolina. I'm Titus, a gastroenterologist with Riverside.